Call the meeting of the Board of Health of February 1st to order. The first item under new business is acceptance of the January 11th meeting. Do I have a motion to accept the minutes of the January 11th meeting?
Motion to accept.
Second.
Thank you. The next item on the agenda is the Trinity EMS report and notification submitted by John Kelly. And John's here tonight. And we'll review that. I guess we'll start by looking at the fourth quarter report to the Lowell Board of Health. And so if we could just go through that. John, did you want to preface?
Yeah, I did want to start with one error today. I do the report twice independently of each other. This month, just with staffing being on the ambulance so much, I only got a chance to do it once. And then I noticed it today on page 8. The transport total is listed as 2888. It's actually 3,013. I'll make that addition for the report next time. But in the column all the way to the right,
Okay.
the 2888 should be 3011. Sorry, 3013.
Under the fourth quarter, total BLS transport?
Yes, ma'am.
Okay. So, okay, that correction will be made.
So on page 4, we were at 85.1% compliance. Obviously, it was a struggle. Staffing, call volume, wall times, all that sort of stuff. If anybody watched the Globe the other day, it's a nationwide problem for EMS. The hospitals are getting overrun. EMS is taking, we're taking 20, 30, 40 minutes to get the patient off the stretcher sometimes. So that means that's 20, 30 minutes additional time that ambulance is out of service that can't be reposted or can't respond on a call. So you end up sending ambulances kind of from farther directions in. If you go to, I know we all worry about the patient's condition and all that. If you go to page 7, that's the response times over 12 minutes. If you go through them, what ends up happening is most of them are psychiatric calls, falls for a couple days. So what ends up happening is we'll have one ambulance left in the city as the others are either holding the wall or whatever the case is. You'll start to send them on a psych. So they'll start responding to a psych. Then a chest pain call comes in. So we pull off the psych run, we cancel that, and then they go to the chest pain call. So that the psych patient ends up waiting a little bit longer. Usually what ends up happening, we end up waiting for LPD anyways. And I know that's one of the things the state on January 3rd made a big transition. Locally, we went from using Leahy Behavioral to VinFin for the kind of the outpatient psych. We're trying to divert the patients from going to the ER so much and interact with EMS as well. So we're hoping that will alleviate that somewhat for us. We're the provider for Lowell General, so we do all their long-distance Section 12s. We'll go to Pembroke, and it takes an ambulance out of service for 5 hours. We've seen a big decrease in that with the new kind of VinFin rollout, where they're trying to treat people locally instead of shipping them off long distance.
What is the FinFin rollout?
FinFin.
Yeah, VinFin, I'm sorry, with a V. Yeah, so that came out January 3rd. So the state of Massachusetts took a whole new approach to Section 12s in psychiatric emergencies. So Lowell General has, I think they even have a 24/7 psych clinician now in the ER. And they have this is Casey.
Hi, Casey.
Yeah, so this was this was part of a statewide initiative for managing the behavioral health crisis in Massachusetts. Obviously, here in Lowell, we have an enormous population that are often holding in the emergency department, waiting for placement in inpatient psychiatric facilities. So what John's speaking to as far as VinFin goes are these community-based behavioral health centers that help to stabilize, disposition the patients who are having a psychiatric crisis. So it's certainly a work in progress, but it's really moving forward at a really great pace right now. But it is sort of a total package thing that we're working through, and certainly, placement and stabilization here in the community is a big part of that.
Thank you.
So continue on page 7. Those are the response times over 12 minutes. This is the most we've ever had. But again, if you look through them, a lot of them are fever, back pain, and what we're doing is we're pulling ambulances off that response and sending them anywhere else. The beauty of the setup in Lowell is with the Lowell Fire Department, right, with their first responders. They provide great care. A lot of them work for us. They're fantastic clinicians. So even if it does take us a little bit longer to get there than we would like, the patients for those critical ones, you know, the chest pain, shortness of breath, cardiac arrest, overdoses, they're getting good quality care right away. The fire department's usually there within 3 or 4 minutes.
Okay. So just to go back a little to page 5. So 27% of the over 8-minute calls and 39% of the over 12-minute calls on page 6 are related to call volume. Is that right?
Yeah, so what we do, call volume would be the 5th or more concurrent 911 call in the system.
Okay. So really what you're saying is that it's related to call volume. Does that mean, so it relates to number of trucks available and not, are not available?
Not necessarily.
No.
It's just, that's just the value of how many concurrent 911 calls there were. Like,
On the
there's
line.
instances we have 8 available, but if they, you know, when we post the trucks around the city, right, once you get to that 5th truck, no matter how many ambulances you have, even if you had 7, you can't cover the big 3 posts for us, right? So we start a truck at Chelmsford, if we have level 1, which we call it, right? So there's a truck at Chelmsford and Westford Street, and then the 2nd truck goes to Aiken and VFW, the 3rd truck goes to Callery Park, right? So once you get to 5 or 6 concurrent 911 calls, there aren't as many chips to put out on the street. So you have a truck at Chelmsford and Westford Street. Now that call that's on out at Chelmsford Street, instead of responding from Callery, you're going from Chelmsford and Westford. So it ends up being those longer response times. I mean, I guess if you had 12 ambulances, it wouldn't make much of a difference, but I don't think Boston even runs 12 anymore.
Right. I'm just, you know, like you said, the response times are longer than they have been,
Yes.
and it's related to call volume, I guess you're saying. No? So you're saying it's not really
It's a
related?
mix. So it's a mix between the call volume. It's a mix between staffing levels. You know, we're not immune to it, just like every other EMS agency in the United States. And then wall times as well, right?
So when you say it's related to staffing levels, I didn't mean to interrupt you.
No, please.
When you say it's staffing levels, isn't that ambulances? Staffing of
Yeah, but,
ambulances?
all right, I see what you're saying. But just because in that instance it says the 911 call volume, we may have had 9 trucks, or we might have had 1 truck, but it's still that same reason. You know what I'm trying to think how to say it. It's just a category. It's not an explanation of what transpired at that point.
Right.
If that makes sense. Maybe it doesn't.
How many trucks do you normally have manned in the city? Do you have the same number of trucks that you had last year at this time manned in the city on a daily basis? Oh, I'm so sorry. I forgot about my microphone.
So at this time, so we merged last year with Pride Star. So before the merger, we do have less Trinity trucks than we had pre-merger.
Mm-hmm.
But now we're able to leverage with our Pride Star, right, with our Pride Star partners, or they're not really partners, we're the same
Right.
thing. So we do have less Trinity trucks, but overall, we have Pride Star trucks that we supplement with in the system.
Mm-hmm.
You know, so they're doing discharges out of Lowell General because that's an important element, right, is get the patients out of the hospital. If we said, okay, Lowell General, we can't do anything for you anymore, we could have better response times, right, because you have more ambulances available, but you'd never get a patient into the ER, right? It's a whole, we got to look at about it as a whole,
Right.
you know? And then, again, we do end up kind of field triaging, right? You've got, you know, we get 2 calls from LPD and you have 1 ambulance. You're looking at, it's okay, one's a chest pain, one's a psych.
Right.
Okay, well, we're going to make the psych wait a little bit before we can get there.
Okay.
And kind of a broader than this is Casey and I have started working with the 911 center to try and leverage the skill set that LPD has, so they EMD all the calls. Right now, the information that they gain from EMD doesn't get utilized by the city. So they may get the fact that the patient is a low acuity, but if they're having, let's say they just have chest pain, but there's no other symptoms and they're 28, if we get chest pain right now, I send an ambulance and I send one of Casey's ambulances to that patient. But if it's a 28-year-old with no cardiac history having chest pain, that's a pretty routine call. Eventually what we can do, which is the project we're working with Dr. Drake and Casey and the organizations, trying to figure out how we can say, okay, we can take what LPD's dispatch does, says, okay, that's not an urgent call, and then we can go no lights, no sirens to that patient, which then keeps ambulances available for the ones that are deemed more prevalent. that makes sense. So it's you know, EMS nationwide is struggling. You know, we're not immune to anything. You know, we have the benefit of being with Pride Star now, so that gives us a whole bunch of extra trucks we didn't have before. We have Lowell Fire, who's fantastic to, you know, provide the care for the patients. And then, again, we're thinking longer term, working with LPD, working with Dr. Drake and Casey and Lowell General to, like, how do we evolve this even further? Because to be honest with you, a lot of times we respond to lights and sirens, there's really no reason, right? We're not at a point yet where we can say that definitively.
Okay.
As far as for your staffing too, I remember, I could be wrong, I'm probably messing this up, but you had discussed maybe starting a program where there would be some training, you know, to try to bring in more trainees to man the trucks and students and things like that. It was a while ago, and I remember, forgive me, I can't remember what you were calling it, but is there any status
Yeah, so we have-
update on how your training or your recruitment is going?
We have what the state of Massachusetts put out at the beginning of the pandemic. It's called an EFR, Emergency First Responder. So what they allow you to do, the state, whether it's an emergency or transfer truck, they allow you to have one EMT or one paramedic in an EFR. Because the EFR trains about 30 hours or 40 hours.
Right.
It's pretty short.
Right.
We utilize them on the Pride Star side. We don't use them on 911 trucks in the city. But what that did was we can take an EFR, put them on a truck, on a Pride Star truck that does the dialysis calls and does the discharges out of the hospital. And then we're able to take that EMT that was on the Pride Star truck and put him on a Trinity truck. So we've done that. I know Dave Green is our lead educator. So we have 2 EMT classes going on right now. I think, I'm sorry? 40 people. So what we do at the beginning of the class is Dave goes out and tries to recruit those people that don't have full-time jobs. He tries to get them to get their EFR certifications before, and then it's a natural transition, right? So they take their EMT class with us, they work as an EFR. Once they get their EMT, they just slide into the EMT seat, and we kind of keep going.
Okay.
Okay. Okay. Yeah, that's great. Thank you. Does the board have any other questions around the response calls? I had a question on page 8. So the syringe pickup, I assume that the pickup dropped off, you know, considerably. We have a health department staffer that does a lot of it,
Yep.
syringe pickup now. And so the ones that are picked up, is that when he's off?
Or nights or weekends, sure. Yeah, so Andres is out there 9 to 5 or 6 to whatever he does Monday through Friday. But if it's 9 o'clock at night and the city calls us, hey, there's a syringe on, you know, at City Hall, we don't want to wait till the morning when he comes in, so we just go by and pick it up.
Great. Okay. And then on page 9, under the Q4 report, under LGH, ALS, MAI, intubation. So Q3 was 17 of 17, Q4 is blank. Is that,
No, that's Trinity Lowell.
so this LGH, the ALS, under the intubation total.
Oh, I see what you're saying, yeah. No, I'm sorry, I forgot to type that in. I was trying to figure out where it was.
Okay.
Remember what the number was?
It's okay, you can, if you want to just
Yeah, that's-
fill it in next time, I just wondered why it was blank.
Yeah.
Okay. I assume the rate was still as good?
Oh, yeah, there's,
Okay,
yeah, we don't really have any concerns about that. Well,
okay, any other questions on the Trinity report? Was there anything else you wanted to mention on the Q4 report?
nope,
Okay,
thank you,
great, thank you.
Thank you so much.
thank you,
Thank you for coming.
thank you.
See you soon.
All right, take care.
The next item on the agenda is the Tobacco Control Monthly Report, and submitted by Cesar, Program Director at the Health Department. And we have in the packet the Lowell Tobacco Control Report, January 2023. And we have a list of establishments that sold to minors.
Yes.
Go ahead, Caesar.
Before I get to those, that list of establishments that violated the law by selling tobacco to a minor, I'd just like to review the proposed changes to the local regulations. You have in front of you a document that has, I believe, 8 pages, and now it has 10 items. I just want to go over the history of this before I go and suggest the next step. I think it was about March last year, I came up with a list of proposed changes to the local regulations and with a rationale for why it'll be important to do so. Once the board reviewed that with me, then the next step was to develop proposed language to actually change the local regulations before we can just move forward. So in November, I presented you with the first draft with those proposed changes. In that meeting, we decided to remove one of the items, which was a confiscation item. It's been removed. And then the next step was to have this document be reviewed by the law department, which the law department did review, and they found no issues with the changes. Not with the changes themselves, not with the way they were formulated. And the law department also agreed with me that there's a city ordinance that addresses synthetic drugs, and that ordinance, in my estimation, would also cover Delta-8 products. That was one of the items on the proposed changes. And the law department agreed with me that it does cover Delta-8 as it is, as they have defined marijuana and synthetic drugs in that ordinance. So I have removed that proposed change from this document. So now we have 10 items. And if the board doesn't have any more questions about these items, that we have reviewed them a couple times already, then the next step will be to schedule a time for a public hearing. So if the board is so inclined, my suggestion would be to go with a public hearing in May. And the reason why I'm suggesting May is because of this long list of violators that you have before you in my report. So we have 16 sales of tobacco to minors. So that's 16 hearings that the board will have to process before we get to look at a public hearing to change the local regulations. So most likely, we do 8 hearings in March and 8 hearings in April. This will leave us May as an ideal month for us to do a public hearing. If you want to address that first, then I can just answer specific questions about the violations.
Okay. So perhaps in next month's packet, we could get, so these are the proposed changes to the regulation. Maybe the original regulation and have the changes,
Well, this one does have the existing
it has
language.
the current.
It has the current
Because
language.
we're just getting this tonight, so we haven't looked at, we've seen
Oh, no, you saw it the last time in November.
we've seen a version, right? It's been updated since the last
Right.
time.
The only difference, I have a copy of the previous one here. The only difference is I removed the confiscation item, which the board agreed to remove it, and then the remainder was to be sent to the law department for review. So the changes that you want to have made
Okay.
have already been made.
Okay, all right, and so you're proposing that we do, so then let's go to, does anyone else have any questions or comments about the proposed regulation changes?
No.
So, so we have 16 establishments that have violated the tobacco sale regulation.
You're right, and that's why I'm suggesting that a public hearing probably the best time would be May, because we can't do this in one, I mean, we could do this in one public meeting, process all the hearings on these sell to minors, but it's 16, it's going to take a long time, and quite a bit of a chunk of your agenda time on each of these meetings in April and March. So my suggestion is we do 8 of these hearings in March, 8 in April, and then we do a public hearing on the proposed changes in May.
Okay. And what is the wish of the body? Is that good with the board?
Sounds reasonable.
Okay. So the plan, Madam Secretary, will be to have 8 of the establishments come to the March meeting, 8 establishments come for a hearing in the April meeting, and on the May meeting, we'll schedule a public hearing for the proposed tobacco regulation changes. Need a vote? Okay.
Yes.
You need to put your mic on, though.
Yes.
Yes.
Yes. Yes.
Great. As far as the sale to minors, on those particular dates, I was using an 18-year-old boy to do these compliance checks. He was not challenged by any one of these establishments. It just sold without asking for ID or anything else. 3 of these violators are actually a second offense, so they were each issued a cease and desist order with a $2,000 fine. One of them has requested a public hearing to dispute the facts of this violation. The one that did that with 7-Eleven at 463 Chelmsford Street. The other 2, Lucky Corner at 1300 Gorham Street and Joe's Quick March, 300 Merrimack Street, have not come up and asked for a public hearing. They only have 7 days to do so. They're beyond the 7 days now, but they're still within the 21 days to make a payment. So actually half of these have not submitted a payment yet, and 8 of them actually have paid. The ones that have paid is Lowell Quick Mart, the 627 Chelmsford Street, Ornella's Liquors at 1088 Gorham Street, Hafner's at 215 Dutton Street,
Pardon me.
Country Farms at 268 Branch Street, Appleton Liquors, 171, I'm sorry, not Appleton Liquors, Lemon Tree Shops at 220 Appleton Street, The Liquor Shop at 1201 Bridge Street, Jerry's Food Store 2 at 207 University Avenue, and Lakeview Liquors at 815 Lakeview Avenue. These have paid their $1,000 fines. There remain that have not done so, but they still have time to pay
So
them.
they have 21 days?
Yes. And they all received, most of them received their notifications on the 20th, so they got time.
Okay. And it would be helpful, I'm sure that you usually do this, when we have them come before March, April meeting, that we know their previous violation.
Sure, we'll do so.
Okay. Anything else, sir?
I'm done, that's it.
Okay.
Thank you very much for your time.
Have a good night.
You as well.
The next item on the agenda is the Development Services Report submitted by Senior Sanitary Code Inspector Jimmy Lee. Good evening.
Good evening, Board.
Okay, so do you want to start? And just, is there anything particular from the report that you want to note to the board, or?
Let's start with the ongoing Gold Star issue because we have some of the people here today. So as they talked about last meeting, current owner is going to be stepping down. The son and employee here are going to be taking over. I've talked to them over the last few weeks. We've decided to kind of start over, give them a clean slate. If they want to take over as the new owners, they'll have to apply for new permits. That way, on paper, Jimmy is no longer going to be the owner. It is my hope that he stays out of the food handling side of things and let them run the new business.
Okay, is the business for sale, the property for sale, or?
I mean, it's listed online. I don't really know anything about the commercial space.
So you're purchasing the property?
No, the dad's gifting it.
Okay, all right, so, but you're planning on managing the restaurant?
Yes. We'll start out.
Okay. Okay, and do we have a time frame for when they want or would like to reopen, or they haven't applied for any of the permits, or?
We have yet to receive any applications. So
Okay.
as soon as they get their paperwork, application together, I can be out there as soon as they're ready. So I think
So we have to get new applications for a restaurant permit and a council permit as far as so.
you'll need a building permit. They call it the maintain use permit. That includes like a fire inspection and pretty much the safety of the building as a whole. Right.
We're just going through the process of, transferring the name, to be seen as the owner of the business. It takes some time. We're in the process of getting the restaurant deeply cleaned everywhere. Jimmy mentioned about the tiles on the back door as well, so we're getting that as well.
Guys,
And as we go along, we'll update you all the things that we change. And of course, after his blessing, we'll be willing to reopen again.
Okay, all right,
Also,
Okay.
have an external contractor clean at least once a month.
okay, so we'll look forward to seeing you at a future meeting,
Perfect.
okay?
We just want to make sure that we update you on everything because we want to work together with you guys to make sure.
We call you once the restaurant's clean, you can come in and see what else we need to do.
I think you need to first, and then
We can stop cleaning it.
No, so, yeah, Jimmy will work with,
I mean, nothing's stopping me from coming in. and
Mr. Lee's
helping you
son.
guys out as far as taking a look if you guys need advice. I don't mind coming. I'm just, it's just you can't sell food until that stuff is done. So I'll go out there anytime.
Is that way you can give me proper, you look up online, like expiration dates on products. Every restaurant's different.
so Jimmy can work with you on that.
Right.
Okay, so, all right, so you're all set? All right, thank you.
Thank you.
So if you want to go to, so what do you want to do next? The failed inspections?
Sure.
Good night.
Thank you.
Thank you.
So all of these failed inspections, pretty much, it's no different from month to month. I just wanted to make note the A&R African market. If you guys remember, this is a market. What was that?
Did you close them?
Right, they're closed. They've been closed before, so it's an ongoing issue with them. They're the ones, the market with the mannequins outside at the end of the connector. They were
So can you just
Yeah, I'm
speak a little bit louder? So which market are you talking about?
A&R African market is the first item on the list of the failed failed restaurants.
I don't have that.
That was on.
It's a little ways now.
They just emailed us.
No, I don't see it.
It doesn't say A&R.
It's different than mine.
Oh, Lisa, I think
Oh,
that's
I
the
don't
one I
have it.
updated.
I don't have that.
Right,
That's Aramark. He said African. African market?
right.
Carrie said she updated the,
So when I mailed out the packet, it was the old list, but it was before we posted it online, but I'd already sent your packets in the mail. So I sent an email out that said, here's the new one.
Oh,
you can ignore it,
Okay.
it's the packet.
Okay, so I
Okay,
didn't
so go
see
ahead,
that.
I'm
Okay.
sorry about that.
Okay, I'm sorry. So go ahead.
So half of the business is selling products. The other half was selling food products. And he did build a commercial kitchen in this space, and he was trying to cook food and then sell already cooked foods. Last year, we decided to close that portion of it because of the maintenance of the building just wasn't a sanitary place to provide food. He'd agreed to get rid of all the food products. Canned foods, packaged food, cooked food, everything. He agreed to decommission the kitchen, not use it pretty much, and I allowed him to stay open if he's just selling, products like he sells dresses and hair, accessories and stuff. We got a complaint the other day that a gentleman went in there, bought some food from him, and that the food was cooked using expired products. We went out there immediately because he doesn't have a food permit. We had already discussed this probably about a week prior, that he wouldn't need one, given him not selling any food. He won't have one. So went there, and of course he's cooking a giant pot of stew. And I said, I've been there a million times. So I said, you know why I'm here. You can't be doing this. And he said that he's not cooking it for sale. He said that he's making his lunch, which is hard to believe because it's about a pot this big. So the way it was, I personally cannot trust him not cooking food there because he has a kitchen. I have talked to the department, and we have decided the only way that we can allow him to continue is if he decommissions the kitchen altogether. That way we're sure that this can't happen again. I had asked him to come here tonight. and he said he will not appear unless he has a written notice for his lawyer to review first.
Okay.
So yeah. So as of right now, there's a closed sign on his door. He's not able to sell food, but I'll let him stay open to sell his other wares.
So he's selling other things other than food. Is he interested or able to apply for a food permit, or?
He can, given if
But he doesn't currently
Every-
have a food permit, so he can't sell food.
right.
And he understands that.
Yeah, he understands it, but I don't know if
Right.
he's
Right.
actively trying to do that.
So do you want to send him an official invitation to the board?
Yes.
Okay. Okay. Do we need a motion? Do we have a motion to send the owner of A&R African Market on 558 Gorham Street a letter requesting he appear before the Board of Health regarding selling food without a food permit?
Yes, motion for that. I'll second that.
Second. All those in favor?
Aye.
Thank you. Okay. So I do see that on the inspection report of all the, and it's amazing how many places that you inspect in a given time period. But I know that there was an attempt to try to get them closer to the 6 month,
Right.
every 6 months. There are some places that are now creeping into the 9 and 10 month
Right.
cycle. Is that because their
So-
inspectors are behind?
So we're finally full staff now. And one of our newest inspectors, I want kind of everyone to get a handle and an idea of the whole scope of what we do as health inspectors. So I've been pretty much redistricting and changing up everybody's workload, giving people different restaurants here and there. So in that whole mix of things, a few of them kind of got behind the
Okay.
confusion between their lists on their computers and my lists. But in the next week or so, everything it will all be with.
Great. Great. Glad to hear you're full staffed.
Thank you.
Okay, and then there are 4 new establishments opened.
Yep.
Okay. Any questions on the inspection report from the board?
This floor is dirty on Honest Lowellwood Street. Can you tell us a little bit about that inspection? Know what the plan is for them?
Repeat that?
Honest Lowell, 21 Wood Street, floor dirty with food and grease, open food
Right.
containers, readily cooked food on the floor, and mice droppings in the storage area.
So this particular restaurant, they have their ups and downs. We ask them to clean, they'll clean it. The problem is, if you look in the back in their prep area, it's very, very narrow. It's just really long, and they've got probably 24 different cooks in there at any given moment. It's extremely busy. It's not an excuse to why it's such a mess in there, but oftentimes we end up finding quite a bit of like food debris, like onion skins, and when they're prepping vegetables, they kind of just get left on the floor.
Okay.
These guys, we'd recommended they hire a professional cleaning service, because after working with them, we've come to realize that it's maybe too much for them to clean after their shift. Most restaurants at the end of the day, they clean everything, they close up. These guys don't do that. So as of right now, everything is fine. They've gotten their exterminator in there. Everything's clean. Everything's off the floor. It's just we're only there, twice a year, so it's tough. But they do have a contract, so I did review their contract for them to get someone in there to clean. So,
Okay, anything else? Question?
nope, I think I'm good.
Very good. Okay, thank you very much.
Thank you.
See you in March. Okay, under old business, we have the Biotics and Analytics Duck Island Wastewater Treatment Facility Report. regarding the concentration of COVID virus in the wastewater. Any questions?
Still turning down.
Still trending down. It's a good thing. The next item on the agenda is the Immaculate Conception letter that went to the parents regarding DEP and the lead in the samples of water from the taps at the school that have been shut off since actually 2016. The health director last month was asked to follow up on the lead levels in the water, and the principal has responded that these bubblers have been shut off, continue to be shut off, and she has applied for a grant for water bottle filling stations. Does anyone have any, Lisa, did you have anything you wanted to say?
No, I had nothing to add. She responded very quickly.
Okay. Anyone else? The next item on the agenda is the director's report. Lisa Golden, the director of HHS, is here. We have in our packet the public health. Do you want to start with the director's report, or go right to the division reports?
So there's a couple of new staff in the health department. So Nicole Chauncey, this is her first month doing the public health nursing report, which is very nice to have her back. This is the first week of having a substance abuse coordinator. So we're just about up to par. And we just put out an offer to the last school health position. So hopefully we'll be up to full staff for school nurses.
Great.
Who's the
Yeah,
new
that's great.
substance abuse coordinator?
Devin Goldberg. Today's her
Devin,
third
does he
day.
come from?
Devin, she
She.
was, she's actually been in the city, so she has a master's in public health, and she's been working she's been working in different areas in the city.
Great. So in the Public Health Nursing Division report, it's mentioned that the Public Health Nursing team is continuing to offer flu shots and COVID boosters, and since we're being televised this evening, I just wanted the public to know that they can still get their COVID vaccine or their flu vaccine on Tuesdays from 4 to 7 at the health department. You can either go to lowellma.gov, the website to the health department, and make an appointment, or call the health department at 978-970-4010 if you'd like to make an appointment for COVID or flu vaccine. Okay. In the substance abuse report, I think it's worth noting that there were over 5,000 syringes picked up in the month of January by our Lowell Health Department, the staff member going out, either responding to requests or proactively going out picking up syringes at various sites around the city.
Andres has been very busy. He's happy there's no snow on the ground.
He gets to continue to do his job without having to wait for the snow to melt.
Correct.
Andres is the syringe collection program coordinator, and he does a great job. Okay. And then we have the school health report. And I just had a question about, so under nursing assessment, the number of students getting a nursing assessment. If you look at September, it was 8,000, October 9,000, November 4,000. And I wasn't sure what that referred to, because it was obviously there was 11,748 student encounters with the school nurses. And I wasn't sure, and maybe Beth can comment on this in the next month's report about, or maybe what, so there's like half, and I wasn't sure what that was.
Right. So we actually have a little bit of a problem running the report from health office. So she has a request into the help desk. So this may not be completely accurate numbers, but she actually wanted to give you like the vision and hearing and BMI numbers so that you had something for
Oh,
today.
okay.
So she does have a little bit of a problem running the report.
Oh, okay.
Yep.
All right, well, that's good to know.
So hopefully next month it'll be a little bit more accurate.
Okay. And Director Golden, did you have anything else?
Nope, I think the staffing and these reports were all that I had.
Okay, great.
Thank you.
And does the board have any questions or comments? No. Do we have a motion to adjourn?
Motion to adjourn?
Second? Second?
Yes.
All those in favor?
Aye.
Thank you. Thank you very much.